Hi everyone, it's Nurse Yalda from Rejuvenation Clinic. For this young lady, we are going to do Kybella. Kybella is a deoxycholic acid. It's one of my favorite treatments for patients who have a healthy tissue, but they just have a little bit of extra fat pad, whether it's for the submental, which is FDA approved, or if there's a little bit of a fat pad around the jowling or cheeks. Basically with deoxycholic acid, Kybella, it's the same enzyme as your body has, and it helps to break down the fat pad. I always use an example that imagine you have a little bit of a butter, and if you start pouring hot water on your butter, it will start melting the fat pad. We have to repeat this treatment at least 2 or 3 sessions. Also, we have to do an assessment. Everyone's submental fat is different, and also your skin quality is super important. Keep in mind that aging starts from top to bottom, and over a period of time, especially after age 30, our body starts losing collagen. So not only when it comes to the neck, submental fat is an area that everyone can struggle with. The excessive skin around the neck also can create a heaviness around the lower face. So be mindful, anything non-surgical takes some sessions, 2 or 3 sessions. Removing the fat pad, it's super important, but also focusing on maintaining the skin quality is very important. One of the laser devices out there in the market is Morpheus 8, and we can get to that later, but it's always a combination of treatment. So for this young lady, we're doing just 1 vial. Keep in mind, 1 vial is about 2 ml. When we're doing the submental, during the assessment, you always want to make sure you have your patient to look down. And during the facelift, or whether it's a liposuction for the neck, your surgeon would not only focus on the submental fat, they always will do liposuction when it comes to your entire neck. So keep in mind that everyone's different. Some patients have a very heavy submental fat, but some patients also have fat pad that it goes all the way back to the neck. For my patient, one of her concerns is when she's smiling, go ahead and smile for me. She does have such a beautiful cheekbone, she has such a beautiful smile, but usually over a period of time, when we gain a little bit of a weight, our lower cheeks becomes much heavier. And when the patient is smiling, it creates this heaviness in this region. So go ahead and relax for me, turn this way. So this is our zygomatic bone. And for anyone that they know, this is where we put our makeup because we're trying to create more like a chisel, sharp cheekbones. And when it comes to the mid-face, it's very important to have a little bit of a support because that's what gives us a support around our tear trough. However, when it comes to this area, which is the mid-cheek fat pad compartment, as we get older, this fat pad descends and it creates a heaviness around our nasolabial fold. So one thing I do for my patients, I have them to smile, I do a quick assessment, and what I'll do for them, I get rid of this little heaviness around the lower cheeks. So go ahead and smile one more time. Relax for me, perfect. So we're just gonna start with 1 vial. Go ahead and smile for me. More. And the left face. Awesome. So as I mentioned, the cheek fat pads are something that we don't want to get rid of. But when it comes to the lower face, unfortunately, the fat pad has a behavior of descending, and it will create a heaviness on the nasolabial fold. So let's go ahead and start treating this area with 1 vial of Kybella deoxycholic acid, which is FDA approved by allergen, especially when it comes to submental fat. Stay tuned.